Hey, Dr. Morse here. I just want to take a minute to show you and demonstrate wound packing as far as controlling the hemorrhage. So ideally we may use a tourniquet because it may be the quickest and most efficient means of controlling the bleeding. However, it may be times, especially in the pelvic, inguinal area, maybe an axillary around our armpit areas, we cannot get a tourniquet on. So I'm going to demonstrate how to wound pack to control the bleeding. So ideally you would use something like this, some type of combat gauze, or more so some hemostatic agent, impregnated gauze to help clot the bleeding. But in this case, I'm just going to demonstrate with some roller gauze to show you how to get that done. So we're going to go to the simulator and we'll demonstrate that. Okay, here's our bleeding wound. As you can see, we do have the bleeding occurring. So let's say this wound is somewhere we cannot place a tourniquet. So again, in the pelvic region, inguinal area, maybe axilla area, that we need to control this bleeding. So we can immediately come up and try direct pressure using this method. The problem is we still have a large opening cavity here the bleeding is going to control to. You don't want to just randomly stick your finger in the hole to control the bleeding, because we don't know what causes injury. There may be bone fragments or pieces of sharp metal, anything like that. So your protection first and foremost. So with the wound packing, and this would be with a hemostatic agent, you want to begin inserting the gauze. We need to fill this cavity so that when we apply pressure, we can control the bleeding. Now, if we knew exactly where the source of bleeding was, if the wound was large enough, then we could place point pressure over it with some hemostatic gauze. In this case, we do not know. So we have the dressing in place. We're going to apply direct pressure. If this was the combat gauze or hemostatic gauze, we'd hold pressure for a couple of minutes till we see the bleeding has stopped. And this would be, again, the simulation for and demonstration for wound packing to control the bleeding.